Good night, guys. My name is Dr. Usmle. If you're new to my channel, tonight I'm just going to tell you how I will be studying for day 9 of the USMLE Step 1 prep. So, as you know, I'm in general practice right now, and school has been postponed indefinitely until I'm able to gather the money for that. But as you know, as I said, I'm in general practice, and most things that you see in general practice will be sinusitis, gastroesophageal reflux disease. Sinusitis will be chronic and acute. You also see peptic ulcer disease. You might see some PR bleeds as a result of 1 or 2 tumors. I've probably seen one case of a person with a rectal tumor that I diagnosed via a barium enema. Very little surgery, very little surgical problems. Because most times when persons have abdominal pain or severe abdominal pain, they go to the hospital. Lots of ear problems, lots of ear aches, lots of ear itching. Hypertension is like the bread and butter. Diabetes is the bread and butter, and pretty much any vaginal candidiasis is another, or vaginal issue is a very common presentation in private practice. So me reading up on those things, like those diseases, won't really make sense. But the drugs that we use to treat those diseases, I maybe need to brush up on a little bit more. And the reason for that is that if you realize, USMLE doesn't ask you how do you treat XYZ. USMLE asks you, for instance, which is the best drug, what does this drug interact with, interactions. They ask you about the CYP liver enzyme inducers and inhibitors. That's the kind of questions that the USMLE asks. So tonight I'll be brushing up on the drugs used to treat those common conditions. Also, the plan is to read up on thrombocytosis. It's not a condition I see very often, but I saw it today, and it's a patient that is on antiplatelet drugs and hydroxyurea. So I will be reading up on treatment of thrombocytosis, and tonight the plan is to get at least 40 questions on UWorld done. Tomorrow I'll tell you if, tomorrow or Friday or Saturday I'll tell you if I was able to get the 40 questions done, but that's the plan. So as I said, this is day 9 of 180, and I'll keep you posted.